Hey, everybody. Welcome back to the Energy MD podcast. I'm your host, Evan Hirsch, and we are on a mission to help people who are tired all the time and have really weird and mystery symptoms get their life back. And we do this by finding the real root causes of illness, which are a combination of heavy metals, chemicals, molds, infections, and trauma. That's what I call the toxic five. So really excited about our speaker today. So I'm going to be interviewing Dr. Jennifer Simmons. So let's learn a little bit about her today. So Dr. Jenn Simmons started her professional career as Philadelphia's first fellowship-trained breast surgeon. After spending 17 years as Philadelphia's top breast surgeon, her own illness led her to discover functional medicine. So enamored with the concept of creating health rather than killing disease, she left traditional medicine and her esteemed surgical position in 2019 and founded Real Health MD with the mission to help women anywhere along the breast cancer journey to truly heal. Dr. Jenn, thank you so much for joining me here today.
I'm delighted to be here today.
So let's talk about breast cancer, and then we'll kind of get into a little bit of the nuances between breast cancer and fatigue. So
Yeah.
let's set the stage so that everybody knows what we're talking about. What is breast cancer?
Yeah. So in the very traditional sense, when we think about breast cancer, it's the uncontrolled growth of breast cells in the breast. But actually, what is happening is that breast cancer is a normal response to an abnormal environment. And we have so many things that create that environmental shift that shift us from the chemistry of joy, which is where you're happy and all of your cells are happy and your chemistry is happy, to the chemistry of stress. And we literally are bathing in this toxic soup that we call a world. And it is physically changing our chemistry so that we look different from a chemical perspective. And because of that, our cells are facing this hostile environment. And so, think about what an animal does when it's backed up into a corner, right? I have a 5.5 pound poodle, but if you try to threaten him, he's 5.5 pounds of teeth, right? Everyone goes into survival mode. And that is exactly what is happening with the breast and breast cells. So we have this toxic environment, and the breast is especially sensitive to all of these environmental toxins. And so the microenvironment of the breast is changing, and the cells are like, what is going on here? I'm going into survival mode. And that's what's happening. But the good news is that if that cell can go into survival mode, it can also come out of survival mode. So what all of us need to do is kind of wave that safe flag and do what we need to do to create an environment that fosters joy, that fosters health, so that our cells can behave the way that they're supposed to behave.
I love that. So you mentioned a couple of things in there. You talked about the breast being exposed to environmental toxins and the response, it sounds like, of the immune system and of different aspects of the body that are kind of seeing these toxins and reacting strongly. And that's part of the process of creating the cancer. Is that
Yes.
what is actually,
Yes,
what's
absolutely.
happening? Yeah.
So what's really happening is a two-front dysfunction where we have this environmental shift that leads to DNA damage, that leads to the formation of cancer cells. And at the same time, we have an all-out failure of the immune system. So the immune system is failing on two fronts. We either are totally underreacting, and that is because our immune systems are exhausted, having been fighting all of these toxins for all of these years, right? Like if your body is busy trying to keep viral load low, if it's busy because you have mold illness, if it's busy because you've had repeated heavy metal exposure because you have a mercury amalgam in your mouth that's been there for 15 years, all of these things suppress your immune system. So if your immune system, and that is not even to say our food, our diet, the things that we consume that are not food, right? And 70% of our immune system is housed in our gut. So if you're constantly exposing your immune system to things that are not food, your immune system is going to be exhausted. So if it's exhausted and when it's exhausted, it doesn't have the opportunity to recognize that cancer in its infancy, because we all make cancer cells from the very young to the very old and everyone in between. But most of the time, these cancer cells are recognized in their infancy and destroyed. But that's with an intact immune system. The vast majority of us are not walking around with an intact immune system for various reasons. And so those cancer cells form, and that population is allowed to expand. And that's what happens. Now, we also have another side of that dysfunction, in that we have overactive immunity, again, because we have all of these stimuli that didn't exist before. So we have things like plastics and viruses and things that are causing this molecular mimicry, where we're having an overreaction of the immune system. And that doesn't work either, because that has the same opportunity. If your immune system is over here dysfunctioning, it can't be over here doing what it's supposed to do. So cancer is a huge immune dysfunction that goes across the spectrum of immune dysfunction.
So, since we're seeing more environmental toxins over time, is there a correlation with breast cancer numbers going up as well?
Without question. So, it's so hard to know the real incidence of breast cancer. We certainly can look at the population studies. So the CDC puts out a breast cancer incidence report every single year. And when you look starting from 1999 up until 2020, of course, we did see a dip in 2020. It's not real. It's because people did not go to screen. So we missed all those screen cancers. But, there is a steady increase. Now, the biggest increase is from between 2012 and 2014 on. And that's because in 2012, we started the liberal use of digital breast tomosynthesis, or 3D mammograms.
Oh, wow.
So with 3D mammograms, when we doubled and tripled the amount of radiation that women were exposed to every year with screening, we caused more breast cancers. So we added to women's toxic load, and we have the breast cancer to prove it. So when we look at it, the number of chemicals that have been introduced into our environment since 2000 is exponential. And none of them are tested synergistically. So even the ones that are tested, they're only tested in isolation. So we don't know what it means to combine PCAs and PCBs with radiation. So that plastic bottle of water that you're drinking as you head into your mammogram, we don't know how much exponentially worse that is, but logic speaks to the fact that it's got to be worse, right? Mm-hmm. So the interesting part is, I don't really follow breast cancer incidence all that much. I follow deaths from breast cancer, and that's the one number that's fairly steady, in that no matter how many women we screen, no matter how many women we treat, the exact same number of women will die of breast cancer every year. So all of the mammographic screening that we're doing, we're definitely causing more breast cancers and treating more breast cancers, that's for sure, but we're not saving any lives. And that's a huge problem. So we really need to cut back on the toxin exposure if we want to see both breast cancer incidence coming down, but ultimately it's going to increase survival, because the less toxins we expose people to, the better function they're going to have. And you know this better than anyone, because we see this direct correlation with toxin exposure and mitochondrial function. And when I look at the breast cancer population, this is on that same spectrum where you can only have mitochondrial dysfunction for so long before you see the manifestation of a disease. And breast cancer, like all chronic diseases, is a mitochondrial dysfunctional disease, which is why, the first thing that everyone will tell me when they get their breast cancer diagnosis is, I'm healthy, but I have breast cancer and I'm tired. Right? They all say, I'm tired.
Yeah, so that's the correlation that I just want to touch on. So since the mitochondria makes between 70 and 90% of our energy, and when you have these environmental toxins that are triggering this process and causing the mitochondrial damage, then you're not making as much energy, and you get the mitochondrial DNA dysfunction, which ends up leading to cancer. And so you can get, that's why these people who have cancer also have fatigue. Did I say that right?
Yep. Yep.
Okay.
So, but it's a twofold issue. It is that, our mitochondria are unhealthy without question. And that is driving these disease states. And the health of our mitochondria is affected by definitely all of these environmental toxins. But one of the biggest toxins that we don't think about is food. And so many people are overfed. And this is one of the reasons why their mitochondria are not working, right? And unless we allow for a fasted state so that the mitochondria can clean themselves up and go through that process of autophagy, this is just this is a cycle that just continues over and over and over again.
So does that mean intermittent fasting, or what do you like to see when you
So,
say overfed?
yeah. So I think that everyone, every single day, should be fasting at least 14 hours every single day, from one day to the next. Like, there is no reason to be eating any more for, everyone should have an overnight fast. But beyond that, when we really talk about cellular repair, you need to get into longer fasts. And these are 2, 3, 4, 5 day fasts. Now, not everyone has to do a water alone fast. I think that the data on the fasting mimicking diet, and from Walter Longo and El Nutra, who has that commercial fasting mimicking diet, the Prolon. I think that the data out of there really does support that you can eat under a certain threshold and still get the benefits of fasting. But I think that one of the keys to health, which is why we historically see it in every religion and every society, that they all have fasting built in. And the only reason that any of us are here today is because we were able to survive a prolonged fast, because there was no refrigeration, there was no agriculture, there was no food storage. You were eating when food was available, and when when it was not available, you were fasting. And so we as human beings are incredibly able to sustain long periods of fasting and be as useful and productive in a fasted state as we are in a fed state. So, for instance, it's not like you could walk out of the cave in the morning, encounter a saber-tooth tiger, and say, can you hang on a minute? I haven't had my breakfast yet. right? Like we are designed to work as well in a fasted state as we are in a fed state. And that fasted state is very necessary for cleanup, for maintenance, for healthy cells. And eating constantly is very aging. It's very aging to the cells. And so I think that everyone needs to have fasting that looks like on a day-to-day basis, having prolonged periods without food, but then on a quarterly basis, also having some real prolonged fasts, 3 to 5 day fasts that are either water fasts or they are, because no one should not be drinking water, right? Like everyone needed water to survive. But to have a 3 to 5 day period where you're not consuming any food or you're consuming food according to that threshold that they determined with the fasting mimicking diet. And that is really vital to health, and it really applies to everyone. Now, we can say that there are some people who have very end stage cancer and they're cachectic, sarcopenic, in that they've lost their muscle mass and they are really in this kind of hyper metabolic phase because the cancer is winning. That person, can they safely fast? I mean, I know stories of people who have gotten on water fasts at that point and actually been able to turn their cancer around. But that is something that, people obviously need a lot of supervision and support in that instance. But most people are way overfed and completely able to sustain a prolonged fast and probably need a prolonged fast. Like if you look at their metabolic markers and, they have elevated fasting insulin, they have elevated fasting glucose. These people really need fasting to turn their metabolism around.
Mm-hmm. And what do you find? How many times does somebody need to do that quarterly fast? Or if they're doing the 14-hour fast every day and then they're doing a quarterly fast, how much time with the right diet, how much time do you feel like it takes to reset their metabolism?
Yeah, so I know that there was a study in type 2 diabetes patients where for 6 months, once a month, they did a 5 day fasting mimicking diet fast. And all of them reduced their need for diabetes medication. All of them lost weight. All of them, their metabolic markers improved. And these are people that didn't do anything in between. All they did was one 5 day fast a month and then went back to their normal eating in between. And remember, their normal eating is what got them to be diabetic. So just adding the fast in was enough for them to lose over 20 pounds in 6 months and have all of their metabolic, like their A1C drop by 1.4 points. It's really astounding information. And so if that's the power of fasting once a month without doing anything in between, you can only imagine the impact that it would have in the context of time restricted eating on top of that, so that you're having a daily 14, 16, 18-hour fast, whatever works for you. And then being mindful about the food that you eat when you are eating, right? And avoiding all of those things that we know interfere with our health, right? Avoiding all of those food-like substances and eating a whole food, plant-based, low glycemic diet. These are things that clinically improve your health.
And so what is it that's happening when somebody is fasting to the cancer? What does that
Yeah.
what does that look like?
Yeah. So what happens is that a normal cell, when it's not exposed to food, a normal cell is able to recognize that there's not food around and change its consumptive pattern. So it's a stressed state, it's an induced stress state. And so that cell at first gets quiet. And then when it realizes that there's still no food around, it says, what can I use for fuel? And so it looks inside of the cell at damaged or misfolded proteins, damaged mitochondria, and it starts to digest those things and uses that for its energy. So it's like an opportunity to clean up the cell and regain the health of the cell by getting rid of damaged cellular contents. A cancer cell is not able to do that. It does not have that ability. And so when a cancer cell is starved, it doesn't have any go-to and it dies. And so we often take advantage of that state when people are getting chemotherapy, because if we can shut down the activity of the normal cells, and then these cancer cells are so active and so needing outside, calories, what we do is we often do insulin-gated chemotherapy. So the cancer cells are taking up all of the chemotherapy and the normal cells are not. So people who fast and then do this insulin-gated chemotherapy, they have far less side effects. So the fatigue, the nausea, all of that, it's not there. They don't get it because the normal cells are so quiet that they're not taking up the chemotherapy and therefore they're not affected by it. And then they have such a dramatic response in terms of tumor reduction for the cancer cells that this is really, I believe that this is the only way that we're going to give chemotherapy in the future, because, and you can significantly lower the dose. So, and in lowering the dose, you get far less of all the negative side effects. So, the normal cell's ability to adapt in a stressful state is not true of a cancer cell. And so there are many opportunities that we can use to take advantage of that. And I often have people who are first diagnosed or they're recently diagnosed with metastatic disease, stage 4 disease, that go on these prolonged fasts and their tumors actually reverse. So
Wow.
it's really astounding, the power of just depriving the body of food for prolonged periods of time and allowing our innate mechanisms to kick in. So we see improved immunity, we see increased T cell function and T cell infiltration into tumors. So it's really amazing the power of fasting and the processes that it turns on in our body.
Fascinating. And on the flip side of the coin, it's also speaking, I think, a little bit to the toxicity associated with sugar,
For
and
sure,
the
without
relationship
question.
between sugar and cancer.
Yes. So, that is on so many fronts. I mean, first of all, we know that for 6 hours after you've consumed sugar, you do have a drop in your immunity. And so if your body, again, going back to even the development of cancer, if your body is busy fighting something over here, it's not going to be present in that breast as that tumor is forming, right? And then cancer is without question a metabolic disease. We talked about that in the context of autophagy and a normal cell being able to stop its metabolism and turn itself off, whereas cancer cells are dependent on constant nutrition. They are growing at at a steady rate, and they're not able to turn off that process. And so in as much as they're not all reliant on sugar, but many of them are glucose reliant. And so as we increase our glucose levels, we are essentially feeding these cancers. So it's really important for anyone who is on a cancer journey to be on a really low glycemic diet. And that's for a multitude of reasons. But the more sugar you take in your diet, the higher an insulin response you're going to require. Insulin itself is a growth hormone. And the last thing that any cancer patient needs when they're on a cancer journey is more insulin, more growth hormone. That's really the last thing you want. And the more insulin like growth factor. And this is like a feed forward process that just promotes cancer growth. So anyone who is on a cancer journey needs to be really, really concerned about their sugar intake and really mindful about keeping insulin levels low, keeping insulin like growth factor low, so as to not promote tumor growth and propagate the disease.
So those candy bowls in the chemotherapy lounge
Yeah.
have got to be maddening for you.
Yeah, that's pure poison. I don't know that that makes me as angry as the Ensure and the Boost that is given to people who are getting chemotherapy, or the advice that they're getting from their medical oncologist saying no matter what you do, don't lose weight. So eat ice cream and pizza and things that like no human should eat ever. So there's so much about it that's maddening to me that it's hard for me to just, put my finger on one thing. There's a lot there to unpack.
Mm-hmm. So fair enough. So let's go back to assessment. So we talked about like the 3D mammograms.
Yeah.
Are you in favor of thermograms, or what do you like to do for assessment to determine if somebody has breast cancer?
Yeah. So, I mean, thermograms use heat. So I don't think they're dangerous in any way. I just don't think they're particularly effective. Um, I never recommend screening mammograms, which is not to say that I don't believe in diagnostic mammograms. So please know that I'm not throwing the baby out with the bathwater. And I do realize that we do have a considerable amount of technological advances, and I think that we should use them when they're appropriate. So to me, screening the general population with mammogram has absolutely no survival advantage. And I know that for every 10,000 women that we screen, we will save one woman's life and cause 7 breast cancers. So the math is not good, right? The numbers don't add up. And the cost to the system and the patients it's the fact that we continue to do this is wrong. It's just wrong. So I don't believe in screening mammogram for anyone. And especially in the BRCA mutation population. So these women that have a mutation in their BRCA gene, the BRCA gene is a cancer protective gene, right? It's a DNA mutation repair gene. So people who are born with a mutation in this gene can't repair their DNA with the same ability that we can. So people who don't have a mutation can. So we take these women who already struggle with the side effects of environmental toxins, and we screen them early and often, right? So we're basically guaranteeing that these women get a breast cancer. That's what we're doing. In telling them to get mammogram early and often, we are guaranteeing that they get a breast cancer. So this is a huge problem. I do not believe in screening mammogram. And up until 2022, I really didn't have very much of a solution. I tell people about doing self-breast examination, and you can get a screening ultrasound. There is some, variables, and they will miss some things, but I don't think they miss too much that's important. However, in 2022, I learned about something called QT imaging. So this is a fascinating story where the NIH gave a $20 million grant to a man named John Clock. And he is a serial inventor. He invented the calcium score, the cardiac calcium score. He invented the virtual colonoscopy. He's a genius. And MRI has been the definitive test for the breast. But MRIs are expensive. They are uncomfortable. They have access issues, and they require the injection of a heavy metal, of gadolinium. And gadolinium is a toxin. Now, we're told that gadolinium is safe and it's no problem. I don't know what you see in your patients, but in my patients, when I screen these people for heavy metals, I'm seeing gadolinium spilling in their urine years after they have had an MRI, years.
Yep.
And we have to remember that whenever we're storing something in the body, we're storing it at the expense of something else, right? So, if we're storing it in the bones, we're storing it at the expense of calcium. We all know what happens when we mobilize calcium out of the bones. It's not good, right? And so, this is another reason why fluoride is a problem. And so, on and on and on. We cannot continue to store these toxins in our body. It has ramifications. So, we were told cigarettes were safe. We were told Celebrex was safe. Vioxx was safe. We were told a lot of things were safe. I mean, I did my surgical residency training in the time of OxyContin. And, I remember the reps coming in and saying, like, this is what you should use for post-op pain, and it's non-addictive. This is what they told us, and we believed it, right? So we have been lied to in the medical, and we're being lied to today. I mean, every radiologist who is doing screening breast mammograms is saying that they're safe. And I hear time and time again people saying that, oh, it's just like riding an airplane. It's the same amount of radiation that you get in an airplane ride. Okay, that may be true, but it is being focused on this breast tissue at a time when the breast tissue is compressed to a fraction of its size. So we're traumatizing the breast and radiating it at the same time. And you can't tell me that that does not have an effect. So I was so grateful to meet this man because he was given this huge grant from the NIH to solve the MRI problem, and he did. So he came up with a device that screens the breast. It was given an FDA approval as a breakthrough device. A woman lies face down on a table, no compression. Her breast goes into a bowl of water. Sound waves, circumferential 360-degree sound waves are transmitted through this water. And an image comes out in anywhere from 2 to 4 minutes, depending on the size of the breast. I'm sorry, 4 to 7 minutes, depending on the size of the breast, with 40 times the resolution of MRI.
Whoa.
Yeah. So though this was not intended to replace mammogram, I can't see why it won't. Because why would you undergo mammogram and expose yourself to trauma and pain and radiation when in as many as 15 minutes, you can have a definitive study of the breast without pain, without radiation, without compression. I mean, so Listen, the big five, the people that make mammograms, the people that make MRIs, they're not happy about it. The radiologists don't love it because they're reading one study instead of reading four. Our system is really not geared towards patient benefit. Our system is geared towards system benefit. And while I think that things will change, right now, there's just too much control from the pharmaceutical industry, from the device industry. There's too much money there for people to do the right thing. But I'm intent on doing the right thing. So I'm going around the country talking about QT, opening imaging centers. I'm going to bring this to the world because I think it's really important.
I love that. And how accessible is the QT imaging?
So right now there's 5 centers open in California. So if you're on the West Coast, you're very lucky. There's 1 center open in Scottsdale, but in the next couple of years, they're going to be everywhere because I'm on a mission to make sure that that happens.
Very cool. Well,
Yeah.
hopefully this podcast will get out to people and more people will be contacting. What can people do to kind of move this along? Should they be requesting it um, of their doctors in order to make them more
So
aware of it, or what do you think?
definitely follow me at Dr. Jenn Simmons on Instagram and Facebook. We are compiling a list of patients. We know who wants this. We know that the demand is huge. And I'm going to be directing people to tons of resources. And we're going to make sure that this happens. But in the meantime, people should say to their doctors, like, this is what I want. Um, Again, because the radiology industry has said that these things are safe and they're gonna die on this one, right? Like they're just gonna go down with the ship on this, kicking and screaming. And I know that it will take time, but I do think that the right thing will prevail. The inventor is very intent on not allowing this technology to be killed because so much of the time that does happen
Hmm.
where when it's too good, people make it go away. He's very intent on that not happening. I'm very intent on that not happening because this is the right thing to do for people. And while I'm so grateful that the breast is the first generation of this technology, this particular imaging technology has far reaching implications because the next generation scanner is for orthopedics.
Hmm.
So instead of going to your orthopedic surgeon office, getting a script for an MRI, having to go get that MRI scheduled, go to an outside place, right? So it's one visit to your orthopedic surgeon, then you have to go get your MRI, then you have to come back to your orthopedic surgeon to have them read it and make a plan and that kind of thing. With this, you go to your orthopedic surgeon, you have your study done, you have your consultation and your plan all in the same time. So it's amazing. And the next generation scanner can scan a gravid uterus, a pregnant woman, because there's no radiation. You can scan a newborn without sedation because there's no radiation. All you have to do is submerge them. So, I mean, the implications for this technology are enormous, enormous. So I'm so grateful to be part of this movement and this change because it's so necessary. And at the end of the day, like as physicians, we need to do what we said we were going to do. First, do no harm. We need to help people. We need to help them heal. And we're not helping them heal if we're exposing them to more toxins that is causing the very dysfunction that we say we're trying to prevent.
Yeah, I agree. That's wonderful. And so it's a sonogram, it's sound waves, but it's a
It's
different.
sound waves, but it's very different than ultrasound in that it's not delivered through a probe, and it's both quantitative and transmission ultrasonography. So it's very different than any other technology that's out there now. I get asked all the time, I have a Sonosign or this or that. It's very different than any of the other technology. And again, the key is that the images that are created have 40 times the resolution of MRI. So it is really the definitive study for the breast. And the really interesting thing about it is that you can count cells. So if you find something that's abnormal, you can bring someone back in 3 months and know if that's an active process or not. So it should cut down on biopsy significantly because we're not going to biopsy something that's not active. And the flip side of it is that because it has this increased resolution, a normal study means that there's really nothing happening in the breast. And that person can not, it doesn't need another study for 2 years.
Wow.
So it's really going to change the way that we screen for breast cancer, but it's also going to change the breast cancer incidence because if we're not radiating people every year, we're not going to be causing those breast cancers.
Mm-hmm. Very exciting. And then is it starting to be picked up by insurance companies yet? And
It
how much
is.
does it cost
It
if
is.
insurance doesn't cover it?
Right. So an uncovered study, which, the nice thing about this is it's completely patient directed. So you don't need a doctor's prescription. You can just self-refer for the study. Depending on where you have it done right now, it's anywhere from $400 to $600. And insurance is starting to reimburse for it. There are 5 CPT codes available for this testing now. And it was given the first FDA approval for screening in 50 years. So, we think about mammogram and we think that it was FDA approved. It was 50 years ago, and everything else has been grandfathered in. And so the fact that this imaging is approved to screen women with dense breasts, which is 40% of the screening population, and the women that need it most, because these are the women that mammogram is failing the most. This is going to have huge implications.
It's very exciting.
But yeah, it is very exciting, but mostly we need to stop causing breast cancers.
Yeah.
For me, that's the most important thing. We need to stop causing breast cancer.
And so for someone who does not have access to a QT image or imaging right now, what's it called? QT imaging?
QT, yeah.
QT. Right now, what do you recommend for assessment?
Yeah, so I really still do believe in self-breast examination. And for me, what that means is once a month. If you are premenopausal and still menstruating, then that once a month is day 7, so 1 week after your period starts. And if you are postmenopausal, that is whatever day you pick, feel them on the first, just whatever routine you get into. Look at your breasts, look to see what they look like, make sure that there's no skin changes, no dimpling, no redness, that kind of thing. And then make sure that you're examining your breasts with your fingertips. They're the most sensitive part of your hand. And I just tell people with a raised arm to go around the breast circumferentially. And if you feel something, it's going to feel like a bump in the road. But these screen cancers that we're picking up, these 5 millimeter cancers and things like that, most of them probably would have never become clinically relevant. They would have never developed into anything. And yet, when we subject women to treatment for breast cancer, we are changing the trajectory of the rest of their lives because the treatments for breast cancer accelerate heart disease, accelerate bone disease, accelerate brain disease. And these are very serious consequences for a cancer that probably would not have affected them in the long run. So, I think that any cancer that is going to be clinically relevant is going to show itself. You're going to be able to feel it. You're going to have some changes. You're going to have some symptomatology. Please be in touch with your body. Listen to yourself. If you feel something, do something about it. Don't say it doesn't hurt, it's nothing, right? Like cancer is not painful until the very, 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 very end. And so I think that when we are in touch with our bodies, we generally know when something changes. But way before you're going to have the development of breast cancer, you're going to have other signals from your body. And I want you to listen to those signals. It's not normal to be tired. It's not normal to have sleep disruption. It's not normal to have bloating. It's not normal to have constipation. It's not normal to have headaches. It's not normal to have anxiety. It's not normal to have depression. All of these things are signals that your body is not doing what it's supposed to do. And there are people like Dr. Hirsch who can help you figure out why you have dysfunction. Because by the time you develop a breast cancer, you are far along that dysfunction spectrum.
Yeah, I would imagine most of the people that you see probably have already received a breast cancer diagnosis, right? Even though you're probably
All of
you're
them at this
all of
point.
them. Yeah.
Yeah.
Yeah, but you're like me in the sense that, you'd love to work with people preventively. Um, but yeah, so then let's talk a little bit about prevention and then we'll conclude. Um, so then what do you recommend for prevention?
So, prevention, at the end of the day, breast health is health, right? So the same things that you're going to do to have healthy breasts, you're going to do to have a healthy heart and a healthy brain and healthy bones and healthy gut and all of that. So I advocate for a whole food, plant-based, low glycemic diet. By the time people develop breast cancer, I add in grain-free diet. But, if you are of normal weight and grains are generally tolerated by you, that's your thing. I don't think anyone should be eating grains. And then having healthy, joyful movement in your body every single day. Our bodies are designed to move, and if you don't move it, you lose it, right? So movement is really important. Having healthy ways to manage stress is of the utmost importance in that alcohol, pot, these things have terrible detrimental effects in the long run. So we all need, the stress is going to be there for all of us. We all need healthy ways to manage that stress. If you're into meditating, if you're into breathing, if you're into dancing, and like it doesn't matter what your thing is, you need to have a thing. And then we need to prioritize sleep. We are a society that values the waking hours, but the truth is that the sleep is where the healing happens. So if you're not sleeping, you're not healing. And so we really all need to prioritize sleep. And then your environment, the toxins in your environment, we have to manage that. Some things are easier than others to manage, but we can all do our part in not drinking out of plastic, not cooking in plastic, not using nonstick, being mindful, doing less, really doing less, like using less products, using less ingredients, just having things in, on, and around us that promote our health rather than detract from it. And then ultimately living a connected life, a purpose-driven life. This is all what drives longevity. And when we look at the blue zones, we know that one of the primary reasons why people live as long as they do is because as they age, they become more valuable in society instead of less.
Mm.
So having that connection, having that purpose is of the utmost importance. So when you do all of those things, that's really the recipe for health. So I think about disease prevention as health promotion.
Well said. So we've come to the end here, but you've got you've got a free gift to
Yeah,
share.
I do. So
Breast owner's
I
guide.
have the breast donors manual. So for for anyone who owns a pair of breasts, this is your pretty much your guide to how to have them be the healthiest they can be. And then I also think I included a link to my book, which is The
Hmm.
Smart Person's Guide to Breast Cancer. And I wrote this book for anyone, anywhere along the breast cancer spectrum to help you to develop a plan to restore your health. And this also applies to people living with metastatic disease because the truth is that the way we started, the same process that transformed those cells to cancer, you can reset the environment and have them transform back to healthy cells. And so for me, I think there's always hope. There's always hope. But the bottom line is that health doesn't happen in a doctor's office, doesn't happen in a hospital. Health happens at home. And what I want to do is teach people how to create their own health in their home.
Well, Dr. Jenn, you've definitely taught me quite a few things today. I so appreciate you coming on. For those of you who are listening, if you have breast cancer, if you know of somebody who does, or if you want to learn more about prevention, please reach out to Dr. Jenn. We'll drop all those links around this episode. And I know you have a summit coming up, so can you tell us a little bit about that?
Yes, absolutely. So the Breast Cancer Breakthrough Summit is going to start January 16th to the 22nd. I co-hosted it with Dr. Veronique Desailliers. She is the author of Heal Breast Cancer or Heal Cancer Naturally. And she's just a brilliant woman. We interviewed over 50 people in the breast cancer space doing absolutely amazing things. This is stuff that you're not going to hear about in other places. And it's an opportunity for people to really hear about cutting edge strategies, but mostly how to empower themselves to change the trajectory of their lives, to take back the control that they lost when they got a breast cancer diagnosis,
Mm.
and to really put their diagnosis behind them with confidence because they have so many amazing tools on how to promote their health. Because when you promote health, disease goes away. So this is just such an amazing group of people that we interviewed, and it's going to be an awesome experience.
And the dates again?
January 16th to the 22nd, and then I think we have an encore weekend the following weekend. For it's 7 days, so I know it's a lot and it's packed with a lot of information, but people do have the opportunity to purchase the summit, and then you can listen at your leisure because there are so many days that are just filled with amazing people, and you're not going to want to miss it.
Excellent. And we will drop a link to that below, and that
Awesome.
is in 2024 for those of you who
Yes.
are listening in the future.
Yes.
So excellent. Thank you, Dr. Jenn. We'll be sure to spread the word.
Great. Thank you.
So if you have chronic fatigue, long COVID, or mast cell activation syndrome and you're looking for help, check us out at energymdmethod.com. We have a program for almost every single budget, and we're here to help. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening and have an amazing day.